Welcome, Alan. I'm so delighted to be with you today. I feel so grateful that a very, very important leader of New Zealand, and especially healthcare, is with me today. And welcome to you. We thought we'll today discuss what kind of transformation you have led across the country in the health of common citizens, and how is that transformation being supported by various stakeholders, including Planview, of course. But let's talk about your mission first.
Thank you, Manoj, and it's an honor to be here today to speak to you as part of this podcast. I guess as part of our mission here at Health New Zealand, just to give people a bit of context, is an organisation that spans all of healthcare in New Zealand. It covers all of the primary care and the secondary care health system as part of our New Zealand government, and it's brought together what were previously about 29 separate health entities. And we're a very small country in New Zealand. There's only about 5.5 million of us, but we had a very, very complicated system of how healthcare was delivered through a whole range of different entities. So since 2022, the New Zealand government has sought to bring all of that together in terms of how services are provided, and also how all of the enabling services, the support services like digital and physical infrastructure, can be done at a national level to transform how we are providing supports to the business, and ultimately with a mission of being able to provide better healthcare to all New Zealanders, and to be able to provide that in a way that's much more equitable than it has been in the past as well. Part of the challenges that we were seeking to address through coming together as a health system were around what was called the postcode lottery. So in other words, people being able to receive better care depending on which part of the country they lived in. So really the one of the goals of this was to bring equity to groups who had been disadvantaged, some of our communities that were more remote and rural than others, by bringing together one system to wrap around them to be able to deliver higher quality healthcare services for all New Zealanders.
Alan, that is a fantastic endeavor. I always am a big proponent of equity, because you can't have some citizens getting more favorable consideration from government, especially on education and healthcare. These two are fundamental pillars of society. And I'm so happy you are doing this for the country. Tell me, what was the baseline when you started in terms of specific diseases or specific problems? And how has it progressed since you took over and till today? And what kind of plans do you have for next 2-3 years?
Yeah, I think for all of us, coming into a new national entity in 2022 was a challenging time. I think, as some of us would recall, even though we might not want to, that was one of the peaks of when we were in the midst of a COVID pandemic as well. So there are a range of challenges for our health system in terms of meeting the demand, not just for acute care for people coming into hospitals, but also for planned care. So in other words, surgical treatments, planned treatments that people needed, as well as being able to uplift the bar for population health in the community. So in other words, how do we keep people well? So there was a raft of challenges across all of those areas. So some people would say, well, why did the government decide that was the right time to launch an ambitious new transformation project? Sometimes, I guess, it's a matter of looking at where the opportunities present themselves, I suppose. So we were in the midst of some quite radical culture change across the health sector as well. The system historically, because there were these 29 different entities, it had a history of working in quite a siloed way, where people weren't necessarily collaborating with each other. Sometimes the care that was provided in the community wasn't particularly well connected to the care that was provided in the hospitals or the surgical care that people needed as well. So I think in some ways, I guess the COVID experience had opened some doors and some different ways of thinking for people. Certainly from a transformation point of view, coming together as a national digital services team, it was probably the most ambitious undertaking that the system had ever sought to do in the history of public health in New Zealand. A lot of the change prior to that had been very organic, and it had been very locally led, or at best regionally led. And so this was the first time that we'd really tried to do something at a national scale. And as I say, setting some of the underpinning foundational parts for digital transformation, while having a strategy to move forward around connected care, common data platforms, equitable access to information, while also being really thoughtful around cybersecurity, patient privacy, all of those types of things. So we'd, I guess, inherited or been part of a system that hadn't been particularly well supported, hadn't been particularly well invested in, I guess, around digital services historically. As I say, because a lot of those decisions were made locally and regionally, a lot of our colleagues from smaller areas, they'd historically had to make really difficult decisions around investment, around what they could afford to invest in and what they didn't. And unfortunately, as you often see, investing in digital transformation or digital modernization often didn't make it to the top of the list. They were there to provide frontline care for their patients. And so those types of things always came first, often at the expense of investing in, those modern digital platforms. So there was, quite a challenging environment to start from, obviously overlaid with that environmental challenge of starting that at quite a difficult time for society, I suppose, as a whole, as we grappled with sort of emerging out the other side of the COVID pandemic.
No, I think that is an outstanding initiative, and the timing is perfect because starting in 22, when the COVID was still around us, I think it was the right time, and you took it at the right time. I feel that governments across the world should pick up lessons from what you have done. So, two questions, Alan. One is that how did technology help you? And second, that how did you connect with all the isolated towns and villages, which before 22 were really not connected with a national scheme or a regional scheme?
Yeah, no, thank you. And two very good questions. And I think there's still a long way to go for us in terms of being able to fully take advantage, I suppose, of those two opportunities. I guess one of the things that we needed to do, first of all, was really just to understand the environment that we operated in. I think like any new organization coming together, there was a big process for us of sort of resetting and rebuilding a national culture rather than having a whole lot of distinct organizational cultures that had all just been merged together. So it took a little bit of time for us to first of all decide, who were we, what was our identity as an organization. A lot of our leaders worked hard in terms of sort of building that shared vision around what we needed to do. In terms of the technology that was there and the environment that we knew that we wanted to utilize and leverage, there were a number of our regions, a number of our areas that had been quite innovative in pushing forward with digital modernization in their areas. So I guess the opportunity was there for us to say in areas like telehealth, in areas like remote patient monitoring, how do we look to learn from those innovations that have been done, often particularly in perhaps local or smaller areas, and then leverage and share and spread some of those things. Telehealth in particular was something that had been around for a long time in the health sector, but hadn't really been fully grasped upon. It was almost like a solution looking for a problem, if I could put it that way, in terms of we had technological solution to offer, but the business hadn't really figured out how to make the most of that opportunity. Again, because COVID had meant that people couldn't attend appointments in person anymore. The system was forced to adapt really, really quickly in terms of using telehealth as a means to get to patients, particularly so that they could have their appointments for plan care, other areas like that, so that via telehealth, so that it took the pressure off the acute hospital system in terms of dealing with patients that really needed it and allowed people to do those things remotely. I think probably some of our initial steps were, reasonably basic. When you think about telehealth, you might think about, digital video conferencing. A lot of our telehealth was just phone calls. It wasn't really, really high-tech stuff that we were looking to do, but I think it allowed us to test some of those principles of working in different ways. And it wasn't easy, and it still isn't easy. It's still a challenge in terms of how do we get the most out of those technologies. So, for example, I think there was a recent telehealth study that thought that across all of our clinicians, just under a quarter of them said that telehealth was appropriate for a first patient appointment. And I think that's just a historical, the nature of how people want to receive healthcare. They want to see a doctor. They want to perhaps bring along a support person or their family to those appointments. It's difficult cool. When you can only do that over the phone, you don't quite get that same engagement or that feeling that, both as a doctor or a clinician and a patient, that you're really getting that same sense of engagement. So I think there are still a number of challenges there that we need to address in terms of how do we, I guess, make the systems work better for us to adopt to those models of care. There've been some really good wins though as well. So for example, there've been a number of pilots around remote patient monitoring, for example. So in other words, patients being able to wear wearable device that helped measure their vital signs so that they didn't need to be in the hospital. They could actually recover at home, knowing that there were teams of experienced clinicians, doctors, nurses, and support people monitoring them at all times, so that if there were any issues, that would easily be picked up, that could be transferred back to someone monitoring those patients, and appropriate interventions could be taken, which meant that freed up a bed for someone that might have needed it more in an acute setting. So there have been some good wins from a technology point of view in digital services, and still a long way to go.
Oh, great. I think that's a great story. Can you, Alan, also share with us some moments of truth, with maybe a couple of moments of truth where you were personally touched by the feedback of patients who were positively impacted by your program? So, any memories you have?
Yeah, I think we undertook some of these pilots out in Middlemore Hospital, which is one of New Zealand's busiest hospitals, where I used to be based as well. And I think for patients, even knowing that some of these options were available to them now, that was quite a revelation. So we had a lot of our team spending time down in the emergency department, out on wards, just to talk to them, I guess, about being part of these pilots around wearable devices, remote patient monitoring, some of these sort of innovations in healthcare. And I think for some people, they were expecting to spend a week alone sitting on a patient ward, recovering, lying in a bed, hoping that their family can come and visit them. There's travel barriers, there's all kinds of barriers, and that's not really the environment that you want to be in when you're already unwell and you're trying to feel better. So for a lot of those patients, I think that was a real game changer for some of them, to be able to feel like, actually, I can recover at home with my family around me, but also know that there is someone looking after me because of some of these digital innovations that we're able to test. So that's not something that's been fully rolled out nationally yet, but that's something that hopefully will be one of those game changers, I guess, from a patient experience point of view, and also from a clinical point of view, in terms of how we transition to, I guess, a more of a virtual care model, rather than needing everybody to be physically in a hospital bed to receive that care. So I think for a lot of our patients, that was something that really helped them recover better, not just physically, but also, I guess, from having that family support around them as well. That's such an important part of our culture here in New Zealand, is having our whānau around us, having our family around us. And so I think, that was a real game changer for some people. And little things like that can make a big difference to people's recovery. So it's nice to feel like you're part of that in some way.
Absolutely. Absolutely. I think that can be a game changer across the world, because you want your family to be close to you while you're going through some medication, going through some medical treatment. So, one hand, you scaled up and touched all the parts of the country which were not fully taken care. Did you also, along with coverage, additional coverage, made it more cost efficient and more affordable in terms of cost per unit or whatever parameters you had? Because that is also important.
Yeah, no, that's a really good question. And that's certainly been a big driver for us. And, again, a lot of our strategy over the last sort of 12 to 18 months is around making sure that we're cost efficient, because obviously, there's a risk when you go into a big national entity like this, that all of a sudden you introduce a whole lot of operating costs which are unsustainable. And that is something that we've had to grapple with. A lot of the financial challenges have meant that we have had to trade off some of the things that we've wanted to do to put them into, I guess, a strategic long-term plan, but not necessarily things that we can do immediately. And so what we have had to focus on is, where can we create those efficiencies? And, there was a lot of areas from, reasonably straightforward things, like making sure that we are, collectively working with the market, working with our vendors in a smarter way. So, for example, we don't need 29 different contracts for Microsoft licenses for people to log into their PCs, things like that were some really quick wins for us, that we were able to work work smarter as a collective unit, leverage our economy of scale, I guess, to make sure that we're getting better deals for the services that we provide. Looking at things where we can, maintain systems at a lower cost by sharing that workload nationally as well. There were some areas, for example, where we had specialist systems where there might only have been one person who knew how to support that system. And, we don't have the luxury of having an environment that can afford to support hundreds and hundreds of really bespoke little clinical applications that had been in use historically. And there's still a long way for us to go there in terms of applications rationalization. But I think for us to be able to work together collectively, agree what is the problem we're trying to solve first before we decide on what the solution is that we need to solve that problem, and then come up with some strategic plans around what's best fit for purpose for the country, rather than, I guess, some of the historical culture where it was sort of like, well, that doesn't work for us because we're a little bit different. And we kind of need to be a little bit smarter in terms of negotiating some of those challenges, I guess, where historically, decision making was very decentralized, to making smart, common, centralized decisions around what works best to create a more sustainable environment for all of us. Because we know, like most public sector entities anywhere in the world, cost pressure is always a major challenge for governments. Different policy settings, different budget settings, things like that impact our ability to invest. And I think part of that is being really smart around the benefits that we're seeking to achieve through investment as well. So in other words, making sure that, when there is investment, that smart, strategic, well thought out investment, rather than historically, maybe some opportunities that perhaps didn't pass a high threshold of justification, but being really smart around where we invest our money going forward, because at the end of the day, we're the custodians of public funding on behalf of the New Zealand government. And, we have to think about our patients, think about our clinicians in terms of what puts them in the best position to have sustainable digital systems that provide the care that they need. So we have to make sure that that's cost efficient as one of our driving principles.
I'm sure these economies of scale will help you more and more in times to come. Also, I'm curious that how did the stakeholders respond? For example, very important, the ecosystem like nurses, doctors, and other stakeholders of the healthcare system. How did they respond to this transformation?
Yeah, that's a really good question. And in some ways, I think for some of our colleagues on the front lines, our doctors, nurses, healthcare support workers, and so on and so forth, for them, perhaps the change was seen as a little bit behind the scenes. That's because they still turn up every day to the hospital that they work at. They provide care for their patients. They're delivering surgeries, delivering appointments, all of those things that they'd normally do. So from I guess from a perception point of view, for some people, the initial change was probably perceived as somebody else's problem to worry about. And I guess part of what we've been trying to do for digital services is come up with an operating model where we have that engagement at all the right levels to help drive us, particularly when we think about the benefits that we're seeking to deliver for clinical teams. They're not our personal benefits as digital services. They belong to the business. They have to be realized in the business. And so if we're not getting good engagement, good relationships, good uptake of systems, technology, platforms, use of data, then we're not doing our job very well. So a lot of our work has been around working as some of those clinical teams work through their own change processes, particularly around working in a more regional way. So we're working towards having sort of 4 regions across New Zealand that work in a way that represents those 4 different regions, and they make clinical decisions. Clinical governance sort of operates at those levels, while having an overhead of having sort of a national standard process around those things. We're working really hard to build those clinical relationships at all levels. A lot of us who've become part of the National Digital Services team have come from one of those environments before as well. So certainly you can never underestimate the value of relationships and the value of being able to build and expand those networks and understand those clinical points of view. Because we could deliver the best digital solutions in the world from a technical point of view, but it could still deliver no benefits if that's not what the clinical teams want at that particular point in time, if we're not actually being responsive to their problems. So we've done a lot of work actually in terms of asking that question of clinical teams. It's all very well to try and tell just the nice stories around all the wonderful things that digital technology has brought, but we've tried to ask the questions, what are the challenges that all of these digital systems have meant for you in your jobs as well? Because because we know that sometimes, if all you had to do was scribble on a piece of paper and hand it to somebody, well, that's very easy, probably not the best process, but actually maybe that was a bit quicker than actually having to put that into a digital system. However, there's a huge number of other benefits of having all of those processes digitized as opposed to, handing a post-it note to the nurse and hoping that nobody drops it when they're walking down the corridor. Because a lot of our systems were like that before this transition. And so, helping our clinical partners to see the big picture as well has been really helpful for them to, understand why we're doing things the way that we're doing it. We're certainly not doing things to make their lives harder, which is sometimes the perception. So I think we just have to be able to tell a really good, coherent system level benefit story to help, build those relationships and help them understand, why we're doing things the way that they are and making sure that we're being responsive to what they need.
Alan, that is so true because inclusivity leads to bigger success. And I think you have been inclusive, and that's very gratifying. Okay, so moving into future now, I recently met your new prime minister, and I think he looks a very, very dynamic person. He looks a person with a vision. So what's your vision for next 3 years? How do you look at what new changes, what new shifts you're going to or you're planning to initiate in the next 2 to 3 years?
Sure, yeah. So I think across our team as a digital services team, we're still in a growth phase. We've still been coming together. We've been, restructuring in response to some I guess government changes and challenges over the last couple of years. So for us, I think what we really are working hard on, a number of our team members are working really hard on, is a really good, robust, long-term investment strategy for digital services. We have been historically quite responsive to investment. We haven't really thought as strategically as we needed to around how we're going to invest, the precious public sector funds that get allocated to us to deliver these things. And so often we've been doing a lot of firefighting, and there is still a lot of firefighting out there where, we've had to change priorities because there's been a major risk which has turned into an issue. So for us, I think being a little bit more strategic and betting in those long-term plans will be a goal for us over the next couple of years. And I think for us, being able to sort of build on some of those early building blocks of success, we're still reasonably in the early days of all being together as an organization and, building those new networks and relationships and really doing that in an integrated way with some of our partners across the business as well. We've got some major new hospital builds going in. We want those builds to be digitally enabled so that you're not just doing the same things in the same old way, but in a nice new building. You're digitally enabling the whole health system through working together. And I think that's one of the things that we haven't always done as good as we could have done as a system, is to be really integrated around our strategic planning around all of the parts that we need to deliver the benefits. So we need the digital infrastructure and the digital investment, but we also need physical infrastructure, and we need to support our clinicians with making sure that they've got the support that they need in the system to, deliver better, different models of care and understand why, the status quo is not sustainable in some of those cases as well. So we've got a number of really strong clinical leaders throughout our organization that help inform those priorities for change. And I think there's some really exciting work coming through, particularly in terms of sort of raising the bar for some of those parts of our system in the digital space that have been really poorly served in the past. There's still parts of our system where they're quite reliant on offline, paper-based systems, things like that, where I think over the next 2 to 3 years, if we can see them get to like a fair, equitable baseline to be able to build and develop from going forward, that's going to put everyone in a fairer place where we can be more confident that, we can provide better care and we can identify, where those care gaps are sitting, because we've got better data underpinning all of the services that we provide as well. So I think those will be some big drivers that we can build from. We certainly want to be ambitious, but we want to be realistic as well around the amount of time it takes to drive through change, even in a small country like New Zealand.
I know, I can understand that, but still it's an ambitious plan, and I'm so happy that you're taking on such a big transformation. And in this transformation process, I wanted to know, how did Planview support you? How did Planview help you to catalyze it? Because I think you need partners to do better and better.
Yeah, absolutely. And I think, certainly for me, when I came on board to the National Digital Services team about 18 months ago, certainly in terms of looking at, how PPM, how Planview could help us was one of my top priorities. I'd come from a region where we had already been using Planview for a little while, and we knew what we could deliver. We knew what value we could deliver through a good implementation of Planview. So that was one of the first things that we started to plan out when I started here was how are we going to deploy this? How are we going to share this? Again, thinking about, some of those equity topics that we touched on. How do we bring everybody up to like a good solid baseline in terms of how we are undertaking our strategic planning work, how we're thinking about delivery and execution, how we're managing resources. For some of our teams, because they came from quite small teams, they'd never really had to work in a major PPM environment before. So a lot of it was around sort of actually explaining to them, I suppose, the benefits that a platform like Planview could deliver for them to help them transition into working as part of a national team. We tried to start with the business processes, not be led by the tool either. So in other words, look to the areas that we needed to standardize, that we needed to work together on in terms of understanding how we wanted to work before we determined how we were going to do that in Planview. We knew that Planview had all the technical ability to help us do those things, but it took us a little bit of time. And we were very measured in terms of doing a series of MVP releases around adding and sustaining more functionality to sort of make sure that we were taking users up a staircase rather than leading them to the face of a cliff, I guess, in terms of the amount of change that we were asking them to absorb in a short amount of time. So, with systems changing, relationships changing, all of those things all at once, we knew we wanted to be ambitious with our Planview launch and our Planview journey. And so, we got ourselves to sort of an initial national launch across our first MVP, probably within about 3 or 4 months from sort of our initial decision to launch. And then we've iteratively been adding more and more functionality and value as we've been going forward. And that's certainly something that we intend to continue to expand out, not just for digital services, but all of our other parts of the business as they're able to come on board with us.
Alan, that is stupendous. I'm sure Planview will support you more and more for bigger success in future. My last question is about you personally and your family. Are you and your family feeling more gratified that you are making such a big societal impact through this mission?
Yeah, that's a really good question, actually. And I guess, while I'm someone that works in programs and transformation and PMO teams, at my heart, I'm a health person. My wife is a healthcare worker. My mother is a healthcare worker. I've got aunts and cousins who are healthcare workers. So it's something that I feel a real personal, I guess, responsibility to do my best, even though I'm not on those front lines treating patients, to be able to contribute something in some way towards our society in terms of how our health sector can work better. Having all of those relationships with people, I hear how hard it is on the front lines. I hear how difficult it is in terms of the challenges that are expected of our clinical workforce, the resource shortages, all of those things that, while we can't completely fix those things with digital services, we can certainly alleviate a little bit of the pressure, and we can certainly build those partnerships with those people in those clinical spaces to make sure that we're taking the health sector in the right direction. So it is certainly something that I have a personal passion for, and as I say, to be able to feel like you're contributing something that not just you but your family and then your wider community can feel like they're getting some benefit from is quite gratifying, I suppose. And I'm sure many of my colleagues, that's why we want to be part of the sector, because we do genuinely believe in the mission for better healthcare for all New Zealanders.